Hi, my name is Snail Desai, and I'm going to go over coronary artery disease, part of the cardiovascular section in this NAPLEX review course. As you can see, this is a table just outlining some of the topics covered in the cardiovascular section. Just so you're aware, some of the medication classes are overlapped between different disease states in cardiovascular disease. So just to note, some of the medications are used and which medications are also not used. You need to understand which ones are used and not used for the test. So just to understand how to classify them between the different disease types here. And also note that there are two highlight sections here. I wanted to highlight this third one because part of it, the fourth one here, because part of it is used in coronary artery disease or acute coronary syndrome or ischemic heart disease, because this topic particularly kind of combines concepts and various other disease states as well. So you'll see in the second, some of these are the treatments, just the overview of what's being used in preventing coronary artery disease or treating some of the related disease states as well. So nitrates, nitroglycerin, these are the typically like medications that are used in emergency cases to relieve chest pain. Beta blockers, these are first line for prevention, especially used for chronic stable angina, which we'll get more into in later slides. Calcium channel blockers, they are just used as add-on therapy um, or alternative to beta blockers, for example. Ranolazine, they're just they are used, but not as much for treatment of coronary artery disease. It's just a sodium current inhibitor. So, and there's a QT prolongation risk. So it's not really used as part of a treatment for coronary artery disease. But I put it up here so you could see it also as one of the options in uh, case by in any sort of case where patients in desperate need for that medication um, for treating their disease. Um, Ischemic heart disease essentially is where there's a reduced oxygenated blood flow to the heart muscle. This is because of blockage, as you can see in the diagram, the plaque or that actually kind of builds up in the artery and then prevents that blood from going to the heart muscle. And so that's when there is more of an oxygen demand, oxygenated blood demand to the heart. That's greater than the supply. So that will lead to ischemia and then chest pain. So this is where there's an imbalance between the demand and the supply of the oxygen. And so that's what ischemic heart disease is. There are different types of heart disease, ischemia heart disease. There are those that is going to be blocking part of the artery and it still allow blood to flow straight to the heart muscle. But then you also have STEMI, which is just complete blocking of that blood flow. You can see how there's only less blood on one side and like you see a whole clump on the other. So that's how this is getting blocked here. So you're not getting much supply there to the heart muscle. Then unstable angina, you could see it gets ruptured here. And that's due to this blood clot here. that ruptures, that atherosclerosis with blood clot. You can see the plaque there and just builds up and kind of piles up here. So what happens here is when that happens, it's going to break this lid off, and then the blood's going to come right out. So that's a rupture that's going to occur. And whenever this happens, it's not going to cause any sort of permanent damage to the heart, but it may still lead to some sort of damage and chest pain, those kind of things, but it's not going to lead any sort of permanent damage. Whereas in STEMI, it's going to cause extensive heart damage. And that's where medication treatments are highly necessary. In STEMI, there is also extensive damage to the heart, just not as much as STEMI. So STEMI is extensive, and NSTEMI is not extensive. It's less extensive. So I guess the way to remember these differences really just remember um, not extensive or less extensive, and versus this one, STEMI is extensive. Okay, so that you guys can be familiar with this. Another very important monitoring parameter that you should be aware of is troponin. Troponin is going to rise when something like this occurs, when there's more occlusion here where in the blood vessel, where the blood is not able to get to the heart muscle because of these plaques. So you're going to see increase in troponin. So that's one important monitoring uh, parameter you should be familiar with. Um, so just making sure that you're aware of that. And then there's variant angina too. I don't really see much of a damage here. Yes, there's a little bit narrowing here, but it's not as terrible as something like unstable angina, for example, or stable angina kind of thing. Stable angina being more um, blockage here. So, so these are some of the treatments for coronary artery disease. Beta blockers, and we have discussed it a couple of times in the past lectures. Beta blockers will help with the angina or chest pains, particularly chronic stable angina. Nitrates will help also with chest pain. Platelets, antiplatelets will help with like myocardial infarction and death. It will prevent future myocardial infarction, death. And then you got statins. Statins will slow the plaque progression. So you're going to see a little bit of how that works too in a couple of slides. ACE inhibitors and ARBs, I'm sure you already seen the mechanism of these. It's mainly used just to improve survival of other disease states that may occur when you have coronary artery disease, and then it leads to a heart attack, heart failure, high blood pressure, or any other comorbidities that patients having. This is typically used as like first line treatment. So just be aware that calcium channel blockers, this is where one of the exceptions come in. Um, it is also another medication that can be used for angina treatment as well. Um, Also want to note the MONA-B acronym because this is where the emergency treatment happens if patients having unstable angina and that blockage of that blood occurs, and the patient's going to have an heart attack due to the real bad excessive chest pain This is typically what's used for emergency treatment for acute coronary syndrome. Morphine, oxygen, nitrogen, aspirin, beta blocker. It's not typically used in this, it doesn't have to be used in this order, but this acronym will help you understand which medications are used in emergency treatment. Um, so just to have an understanding, Mona B. And particularly patient may have unstable angina and is going to have a heart attack, you would administer these medications. And then, so I'm going to go over some of the medications listed. Statin mechanism. So you'll see this in the future dyslipidemia lecture, but to give you an overview, statins basically they work within the liver, and because that's where HMG CoA is converted to mevalonate, and that's through an enzyme known as HMG CoA reductase. Statins block that enzyme so it doesn't convert to mevalonate and then convert to cholesterol. So cholesterol is not synthesized within the liver. Um, so that's what the statins do. They just block that mechanism from synthesizing any cholesterol within the liver. And so whenever that occurs, there's going to be less plasma LDL receptors and it gets cleared away. So statins typically help reduce the LDL levels in the body. So you would see, if you see a patient having high cholesterol on the exam, a case question on it, um, uh, you would know that statin is to be used to help treat cholesterol, high cholesterol, so for that patient. So um, another thing that's important, because cholesterol is a way of causing those plaques inside the arteries. That's why it's important to also use the statin medication to treat that. And then nitrates, as I mentioned, this is mostly a patient having a real bad chest pain emergency and need to use a nitrate. They would typically use something like nitroglycerin or isosorbide nitrate. Nitrates could convert it to nitric oxide, um, basically within the body. You'll see how when that gets converted, it converts via, give me a second. Yeah, it activates the guanylyl cyclase enzyme, and then what happens here, it activates the GTP, and GTP gets converted to cGMP. And with that, when there's an increase in the cGMP, it activates protein kinase G and causes smooth muscle relaxation. So there's an increased level of the oxygen supply and decrease in oxygen demand. So, and this stuff all occurs inside the smooth muscle. So the patient, experiencing chest pain, this is going to help relax that smooth muscle inside the heart and cause, and then just relax it so it doesn't demand high on oxygen, um, oxygen demand. So that's what occurs here. Now, the enzyme used to convert nitrate to nitric oxide is the mitochondrial aldehyde dehydrogenase ALDH2. And what happens is nitrate is a prodrug, so it has to be activated in the smooth muscle to convert to nitric oxide. And that's how that happens here.